technique. Pop onto your tummy for me, please. I talked earlier about how important the relationship between the lumbo-pelvic hip complex is, and how important that alignment of the femur and the acetabulum is in order to be able to absorb load and to be able to distribute it correctly through the body. Because if we can't absorb the load correctly, what happens? What do we do to adapt? And quite commonly, when it comes to SIJ, there's quite commonly a loss of external rotation in this position on the side that's dysfunctional, okay? So, and I do bring the leg out quite far because I like to measure how far down this leg goes. So I lock here, and I know that the test should theoretically be here, but I want something to measure it against. So I want to see how far she is away from the back of her leg. So if she's stuck here, can I change this position? And 9 times out of 10, the answer is yes. And the way I do that is, so we're going to assume that that's the problem. Yeah, she can't get there. Can you lie on this side again, please? Yes, please. Okay, so really nice, really lovely technique. You're going to take the person into this position. Most people can get somewhere near this position. It might look a little bit like this, or a little bit like this. Okay? We're going to drop in to the edge of the TFL with our elbow. Okay? Because I need to be able to control the leg. So you're going to tell me when. Yeah, when that's comfortable, I want you to lower your leg down to bed. So again, it's very collaborative. It's part of teamwork. They feel like they're involved in the treatment, and they're also starting to learn a little bit more about their body and about what's different. So I've given her a little outcome, haven't I? I've measured that hip in prone. Just relax your leg a bit longer. I've measured that hip in prone, okay? And she knew, she could feel how stiff it was. Quite often pinches in the front, and she knows it hasn't touched down. So as soon as I've done this technique and I reassess that and I can touch a leg, they're like, oh my God! So you've already got this buy-in with this increased range of movement. Okay, so I'm going to move a little bit further down. The second one's usually slightly cheekier than the first. Tell me when. Because we've already got some of the tissues to kind of, you know, relax a little bit, put a little bit of length through them. Down already. So this is very active. Lovely. Relax your leg. Let me take it. Take it into extension. Now, I would, like I said at the beginning, I would now reassess. Have I changed the range? Am I happy with where it is? If I've still got, if it's better, but it's still not where it is, then I'm going to add this one in, because this one's horrible, so we don't do it unless we have to. Relax your leg for me. And you tell them it's horrible, okay? I'm going to sink in here, you're going to tell me when I can move and when I can't, okay? Tell me when. There. Yeah, it's really horrible, but everybody has a 6, so I might be much lighter on somebody else, and I'm certainly not going to move. So she's in control now. You tell me when I have to move and when I have to stop. And I'm doing it properly so you can see the result, the actual reaction of it, you know, rather than just demonstrating it. Tell me if I have to stop. Sweet. Now, pretty much 9.5, 10 out of 10, you're going to get a change in, unless they've got massive pathology in the hip, you're going to change that external rotation test in this position. And I can only say that from my experience, so give it a go, try it.